All right, folks, so we have here a model representing the urinary system of the human body. So we'll start over here on this side of the model and look at the adrenal gland, which has the capsule, the cortex, and the medullary region of the adrenal gland. We have here the capsule of the kidney, the cortical region, and we have also the medullary region. Then you'll see here as far as the region where we're collecting the urine, which will drain out of this ureter to the urinary bladder. So we have here minor calyces, we have major calyces, and then we have the renal pelvis draining the urine to the ureter. We'll see here that in the medullary region we have these pyramids. Okay, you'll see that the apex of the pyramid, right, is where we have these openings. These renal papilla will drain the urine into the minor calyx. You'll see here also that they have striations present, which really represent these collecting ducts present throughout the pyramid. Okay. Now, also, if we look over here in this model, since I'm over here already, we have here a lobe. So a renal lobe, will consist of the cortex and the medullary region of the kidney. Okay. We have the renal columns. These columns are present between the pyramids in the medullary region. Let's take a look at the vasculature. So we have here, we're going to look at the red structures first, which are the arteries. So we have here the renal artery, bringing oxygenated blood to the kidneys. Then we have the segmental artery, the interlobar artery, the arcuate arteries, cortical radiate arteries into the cortex. Then we have here the cortical radiate veins, arcuate vein in blue, interlobar vein, and then we have here the renal vein. So know that there's no segmental vein for the kidneys. Okay. Now let's move over to this portion of the model, and we'll see there that we have the nephron represented. So the nephron is the functional and structural unit of the kidney. So these yellow structures here, yellowish green, they would represent the renal corpuscle. The renal corpuscle is comprised of, if you look over here in the model, the knot of capillaries, this capillary bed, this glomerulus, and the glomerular capsule. Okay. So let's come back over here. So we have the glomerulus, the glomerular capsule, the proximal convoluted tubule, the descending lobe of the nephron loop, the ascending lobe of the nephron loop, the distal convoluted tubule, draining filtrate into the collecting ducts. And as the filtrate gets closer to the papillary region, we're going to have then urine draining into the minor calyx right here. Okay. You'll also see that over on this part of the model, we have here these podocytes that are covering the glomerulus, allowing for filtration to take place, but also allowing for not to allow for larger cells and such to leave and enter into the filtrate. This region right here would represent the proximal convoluted tubule. This would represent the distal convoluted tubule. Okay. This would represent the afferent arteriole, the efferent arteriole. So an afferent arteriole is bringing blood to the capillary bed, and efferent arteriole is draining the capillary bed.